decolonisation and indigenous sovereignty, how is it visible, do you think, in the global work for healthcare climate action, including in perhaps the roadmap, the scoring, awards, and exemplars that get used by Healthcare Without Harm?
It's a good question. So, I mean, I think that, I alluded to, a partial answer here when I was showing those trajectories. Colonialism is what created the tremendous inequality in the world today. So, some countries are really wealthy precisely because they, like the history of my country is it committed genocide and exploited the resources that were, the resources in which the native populations were living in harmony with before the colonists came, and then it expanded out into the world. And so the US, which is the core of the global economy, is still based on that system, right? Which is the exploitation of resources from some countries to enrich other countries. And while it's become way more complex than that, and is a very complicated global system with a lot of different nuances and contradictions, at the core, it's that. And so the reason people don't have access to health in some places in the world is because, in part, because of this sort of global system that has stunted the development of some peoples to the benefit of others. And so when we talk about how we are able to, I mean, the whole vision of the roadmap and this work is how can we transform healthcare while at the same time creating a more just system that provides health and access to health and greater equity and greater community wealth around the world. No easy answer to it, but that's sort of at least the vision we're trying to articulate, is that that's what needs to happen. And somehow we need to chart that uncharted territory.
Thanks, Josh. A question for Rhys from Bethany from Pacific Climate Warriors. How can we be sure that Indigenous and non-Indigenous people have a shared understanding of what relational means?
Yes, well, I don't think we can be sure about that, and so I think that's why it's important for actually all of us to understand our positioning and our role within this whole space, and it actually goes back to the need to actually decolonize at different levels, and so that includes for all of us as individuals, but also within the groups, communities, organizations, institutions that we're part of, but because I think that there's clearly a disjunct between the ways in which Indigenous peoples might think of relationality with the natural world, and we heard about that yesterday, in terms of kin-based relationships, and very much a removal of separation between different groups of beings and the natural world, and so I think that we need to really reconcile those understandings of relationality. And what that means really for a place like Aotearoa and for other settler colony, settler colonial nations, is that it means actually investing in Indigenous peoples' knowledges, values, cosmologies, and understanding those as the natural law of this place. And so those are the, if you like, the tikanga that we should be living by. And everyone else, non-Indigenous peoples, other people in Aotearoa and other places, need to then position themselves within that context as in relationality to Indigenous peoples, but also to think about the relationships we have with, for all of us, with our ancestral lands. And I'm certainly including myself in that you don't get to have a name like Rhys Jones without some British ancestry. And so acknowledging that we all have places that we link back to, and we need to understand how those relationships connect us to that land, and what that means for the way in which we engage in the world.
Kia ora, thanks, Rhys. Josh, we've heard a couple of times over the last couple of days how huge the role of preventive medicine could be in this endeavour. Why is it so difficult to model preventive medicine as a high impact action to reduce the carbon footprint of healthcare? Why haven't we managed to do that yet?
It's a great question. I mean, and I saw it flash on the screen. Why didn't you? Was, I think what the specific question was. We tried. And we actually, if you look at the roadmap and you go into the uncharted territory section, there is the modeling that we did around this, around 4 different health interventions and preventative strategies that, and we try to model what, just what the savings in terms of healthcare costs would be, and therefore the reduced healthcare and therefore the reduced emissions from healthcare. And our advisory group was, the reason we didn't put it in the high impact actions was we were not confident enough about the modeling. And so there's questions about, well, if you have a modern health system and somebody quits smoking, they're still going to get sick and die later, and they're going to require a lot of healthcare intervention. And so we have it in there. It's really interesting territory to explore. There's a lot of work, I think, that can be done in fleshing it out. And so I would encourage folks who are interested in that to look at it. We'll be releasing in the next few weeks 4 papers that it's based on. We really hope that this is a field of inquiry, because in the end, it's that, right? The more we can prevent disease and reduce the need for resource-intensive healthcare, the more aligned with a sustainable planet our health systems will be.
Thank you. And Rhys, do you have any comments about that for Aotearoa, do you think?
Sorry, what was the question again?
It was about thinking about preventive action. And I mean, perhaps what might be relevant in Aotearoa is how we might value the recommendations from Y2575 around health equity and preventing and improving hauora Māori through prevention, how we might value that as an effective climate policy.
Yeah, well, I mean, I think there's huge synergies between, the imperatives around health equity and, like the recommendations, as you say, from the Waitangi Tribunal around the kaupapa health inquiry, that were about, investing much more in Māori self-determination around health care and health in general. And so that includes preventive health, and about prioritising equity within that whole preventive health space. And I think so there's huge synergies between that and climate action. I think people have talked quite a bit about the co-benefits for health of well-planned climate action, and that extends to benefits for equity if we plan it in the right way. And if we, again, think about those relational issues and actually understand that the systems we've created, whether that's the health system, economic systems, even relating to preventive health, how those systems are actually the same things that have created the climate crisis, and then to think about how do we disinvest from those and reinvest, if you like, power in indigenous communities and ways of doing things.
Kia ora. And there's a question here about this relationship between colonialism and capitalism, and I think you did sort of touch on that. But really, it's about how do we take those first steps to create, to deconstruct capitalism and find a different paradigm, especially as health professionals. And perhaps this is something that both of you might comment on, starting with Rhys. Give you time to think, Josh.
Yeah, I think those things clearly are linked. So colonialism, capitalism. I think come from that same sort of ideological positioning of a separation of humans and the natural world, and starting to see, rather than seeing the earth and other species as our ancestors and our relatives, we start to see them as commodities to be exploited for our economic gain and other sorts of gains. And I think that then leads to this sort of capitalist extractive processes and industrialism that have contributed, obviously, to a lot of the problems that we're talking about here. And so I think the solutions, are very tricky, and I don't have any great answers as to how to dismantle capitalism. But one thing I think that we can all do is, in whatever we're doing, think about, as I said, how can we disinvest from those systems, even in quite small ways, at personal levels, at perhaps organizational and system levels, but recognizing, like with climate action, individual behavioral change is not going to be enough, and that we need to try and address things at the system, the structural, the policy level. So how can we be advocates for that disinvestment, that decolonization? And I think it's a challenge for all of us I think if we want to be climate activists, we also have to be indigenous rights activists.
Should you want to add anything there around capitalism at a global level, potentially? Oh, can you hear me still, Josh?
Oh, you're talking to me. I'm sorry. You look like you were speaking to somebody else over there. I actually, I mean, I think Rhys said it well, and I don't really have a lot to add. I mean, it's a multi-generational, age-old question that I think one of the strengths of capitalism is it reinvents itself constantly when it's challenged, and so we're seeing that now with the response to the climate crisis. So just add that little.
That's a more mundane question, slightly less smashing the patriarchy question for Josh. There's kind of an issue that's been identified here around trying to advocate for using your guidebook, or no, that's not the right, your roadmap, and putting it into action in hospitals and district health boards here, where there's a barrier for health professionals who aren't in kind of executive leadership positions. How have you seen that addressed at a global?
Yeah, so it's important to make a distinction. I mean, in many ways, the roadmap was developed as a tool and a framework for policymakers. And there are so many other tools and resources that are available for folks who are dealing with the day-to-day nitty-gritty challenges on a hospital ward or in a health facility, wherever you may work. And so, the Global Green and Healthy Hospitals has a lot of those resources. And, if you're a member of GGHH, then you have access to those resources, and it's a free membership. So it's pretty easy if you're not already. And the tool that I mentioned for carbon footprint measurement is which will be out next month, is a great resource for anybody who is sort of wants to move toward understanding their healthcare facilities footprint and take action to decarbonize. And there are tons of other resources as well, including that WHO guidance that I put up on the screen. So there's there's lots there, and I think I'm not sure who the right contact person is where you are, whether it's Carol, who I know is somewhere here in the ether, or somebody else, but and we'd be glad to help you as well.